Hello everyone, this is Dr. John Makoff here. Today I want to talk about the relationships between muscles and organs. Now within the technique called Applied Kinesiology, the doctor who developed it, Dr. George Goodheart, made these observations between different muscle inhibition, which is like where the muscles aren't working to their full capacity. It's not that they're weak, meaning it's not that they just need to be trained more, it's just they're shut down from the nervous system for certain reasons, and how those muscle inhibitions were also related to different organ illnesses or organ deficiencies, spasms, allergies, or it depends on the organ and depends on the system, but how they were relating to each other. And those different patterns have held up over time. And so it's interesting to start to recognize that everything we feel that might be a pain, might be a weakness or inhibition, maybe an overprotection like a spasm, that we feel physically in a muscle, in a joint, in an area, may or may not be from what we think it is. And it's taking that bigger picture view of root cause point of view. So for instance, there's a couple different organs related to the chest muscles. We have chest muscle that helps bring in towards you as well as bring in down from here. And the one that goes straight across, that also relates to the stomach. The one that comes down this way, it relates to the liver. For the heart organ, there's the subscapularis muscle that is part of the internal rotation of your arm, whether it goes this way or this way. And when that's inhibited, that also deals with heart, even the finger flexors. So be able to hold a grip. If you're not able to, that also sometimes indicates heart issues. So you have the different gluteal muscles that relate to your reproductive organs. You have your shoulder deltoid muscles that relate to lungs. You have your neck muscles that relate to sinuses. You have some of your upper trap muscles that relate to your eyes and ears, as well as different relationships. There's also inter-organ relationships that relate to different organs. Because when I have issues with people with eyes and ears, I also looking at their liver, kidney, bladder, other issues there. But speaking of bladder, so front of your shin, your anterior tibialis, that deals with bladder, as well as on the outside peroneals, which is on the outside of your legs, outside. Internal, more the adrenals, as well as the muscle that's the posterior tibialis, which also helps with supporting the arch of your foot. So with dropped arches, there's stuff that can be coming from your hips, but also if you're in adrenal fatigue, that could be part of your dropped arches as well. So there's a lot of these different relationships that hold over time that gives more indication of how your body is talking to you. So just having a muscle pain somewhere doesn't necessarily mean it's a muscle strain, muscle injury. Sometimes it means it is a deeper issue with an organ health. But also there is the relationship with your organs and the emotions. So taking it one step back further is certain emotional stressors that deal with certain emotions are centered around an organ, and that can also affect the muscle. So for instance, liver has anger, frustration, irritability, aggressiveness. Those are different liver emotions. So if there are things that are stimulating that either in the conscious mind or subconscious mind, that can start to inhibit some of your pec muscles. If you have certain lung emotions of fear, bad memories, impending doom, dread, hesitancy, holding back, that can inhibit some of your shoulder muscles. And it's because that deals with the lung. So just trying to give everybody an idea of how different connections, how to see a bigger picture of how the body works. And when you're looking for a root cause, how the body starts to give you signals that you may not realize that you're just trying to get a symptom better. And it's not always about chasing the symptoms, even though that does give you information. It's trying to get to the root cause of why am I feeling this? Why is my body responding this way? Why is my body screaming in this way? And to be able to very, systematically start to observe and assess the body in a very functional and a very root cause focused analysis to try to get to the problem and to help heal and improve the health of the whole body. So if you have any other questions or comments, please leave them below. I hope this was helpful, and we'll see you next time.